fourth day, we want to share with you our journey when it comes to another goal of the GGHH, which is procurement. So this afternoon, our session would focus on one of the key pillars or work that Healthcare Without Harm is focusing this year and next year. So this is a very important work that we do to help us reach the green hospital that we are all together aiming to do. So the discussion this afternoon would focus on the future of sustainable procurement. So that's what I am talking about. So you might know that the healthcare supply chain contributes to 70% of the healthcare's global GHG emissions. Hence, sustainable procurement has a huge potential to reduce the environmental footprint of healthcare itself. The SHIPP project, or the Sustainable Health in Procurement project, aims to reduce GHG and resource depletion and chemical pollution by working with health ministries, with hospitals such as yours, and different health systems. The 4-year project, inspired by a small UNDP and Healthcare Without Harm pilot project funded by the SKOL and UN Foundation, and powered by support from the Swedish government, the Swedish International Development Cooperation Agency, or SIDA as we call it, is at its tail end right now. And hopefully our session this afternoon will be able to report to you the accomplishments of what we've done so far in the project and its impacts to our stakeholders, which are you guys. The session will also promote the principles of sustainable procurement as we move to another phase of the project. So while it is at its tail end, there are so many potentials for expansion and scale up that our SHIPP project has begun and represents and can do in the future. So hopefully we will be able to discuss that this afternoon. And to begin our discussion this afternoon, I would like to call what we call her, our SHIPP captain. So she is the International Sustainability Director of Healthcare Without Harm's SHIPP project to talk about the principles of sustainable procurement, the tools and resources that we have generated for hospitals, and the different sustainable procurement assessment tools for us suppliers as well, so not just hospitals. And then also to introduce us to the sustainable supply chain hotspot tool, as well as the Sustainable Procurement Index on Health. So without further ado, I would like to call on Susan Wilbur. Where she is right now is, I think, deep in the night. And so I'd really like to thank you, Susan, for taking time, for generously sharing with us your time to be with all of us this afternoon. So let's give all a round of applause to our SHIPP captain. Hello, Susan.
Thank you very much, Paeng, and thank you to the Healthcare Without Harm Southeast Asia office for inviting me to join you today for this last session of the virtual pre-GHAC conference. I was delighted to be together with you in Singapore for the last GHAC and look forward to joining you in person when we all get to join each other face-to-face next year in India. Paeng, can you put the slides up? Great, thank you so much. Again, it's my pleasure to be with you as the so-called captain of the Sustainable Health in Procurement program, the SHIPP. Next slide. What I'll be talking about in the next 20-25 minutes, and it may be a bit of a whirlwind, but all of the tools and resources that I'm sharing are available to you in the Global Green and Healthy Hospitals website and through the Healthcare Without Harm office. So we'll talk a bit about the principles and what consists of sustainable procurement, and about the new tool, the new self-assessment tool that has become available to check yourself. Are you ready to implement sustainable procurement? And then, as Payang spoke, I will introduce the carbon hotspots in supply chain assessment tool, and when we have identified hotspots, how we work with suppliers to complete the Sustainable Procurement Index for Health. Next. Sustainable procurement is, as we think of it, preventative medicine, that we consider how we use the products and services in the health setting, and equally or more important, thinking about the elimination of unnecessary products and services, since the most sustainable hospital is the hospital we do not build because it's not necessary, because our communities are healthy and safe. The constellation, these 4 elements or 4 themes that I'll speak about throughout this session, as we look at the products and services that we do buy for health services to reduce the climate impacts and decarbonize through procurement, to reduce pollution by phasing out toxic chemicals, to protect human and labor rights by improving social conditions throughout the supply chain, and to reduce waste and promote circularity through procurement. And we look at the definition of circularity as that of reusing all products, and not the definition that some have included that I consider greenwashing of waste to energy, but through the reuse and recycling of products. Next. Next, thank you. The Sustainable Health and Procurement Project has been a 4-year project together with the UN Development Program, or UNDP, whose purpose is to reduce harm to people and the environment caused by the manufacture, the distribution, the use, and disposal of medical products, and through the implementation of health programs in developing countries. And what you see on screen are the 4 objectives of SHIPP, with objective 1 highlighted because I'm going to be talking about the universally adaptable criteria and standards that we have developed in working together with you, and in the Philippines, in India, and Indonesia, who have been active participants in SHIPP. And you can see that the Sustainable Procurement Index for Health is the key outcome objective of objective 1. The other objectives are to build capacity for being able to implement these criteria and standards. Objective 2 is capacity building with hospitals. Objective 3 is capacity building with suppliers and manufacturers. And objective 4 is to measure our results and celebrate successes, as you did 2 days ago in hearing of the impact stories of health facilities in the region that were involved in SHIPP. Next. I want to take a moment to refresh your access to the 10-goal framework of the Global Green and Healthy Hospitals. That's on the middle of the screen. And you can see among the 10 goals, plus climate action, purchasing or sustainable procurement is a key goal. And I relate the agenda of GGHH to the Sustainable Development Goals, also known as Agenda 2030. And you see SDG 3 prominent, the goal of good health and well-being, and SDG 13 for climate action. But most important as we look at sustainable procurement is SDG 12, the Sustainable Consumption and Production Goal. And there are many targets, and I'm highlighting on this screen the target related to the sound management of chemicals and waste. Next, please. So the next few slides are a part of a new tool that will be programmed early next year into the data center Hippocrates on GGHH Connect. Are you ready for sustainable procurement? Next. When we first look at the readiness to implement, we look at what leadership has participated in. Do you have a sustainability procurement policy, a vision, or a statement of commitment within the organization, such as the UN agencies directors all signed 2 years ago during the SHIPP inception? Do you have goals and objectives that are a part of your overall organization strategy about integrating sustainability into procurement? Are there specific plans and programs, action plans, SOPs, governance? Do you have dedicated resources, financial resources, and human resources? Is there an individual identified who's responsible for sustainable procurement, and that individual is involved in the procurement committees and value-added committees, value analysis committees? Do you have a framework for monitoring and evaluation? Have you made public your commitment to sustainability and engage with your community internally, your community of health workers, and externally with your community as a whole about this program? Next slide, please. Have you identified your organizational priorities? And in the Sustainable Procurement Guide, that we published a year and a half ago, in the Annexes 3 and 4, Annex 3 is a prioritization schematic, and Annex 4 is a suggested high-impact procurement opportunities, priorities that as an organization we've adopted. However, we want you and your health facilities to prioritize yourself using the tool in Annex 3 and contribute to, in the next year, establishing 5 global priorities that we'll all work on together. And as you're thinking about your procurement priorities, are you thinking about the following sustainability concerns, such as climate change, resilience, greenhouse gas reduction, looking at chemicals of concern and substituting for less toxic chemicals, protecting the health and safety of health facility staff, and a new area that we've begun to look at, and our colleagues in Europe are much more advanced, is looking at the labor conditions throughout the value chain, throughout the supply chain. And this year we have experienced and learned about serious human rights violations in the manufacture of medical gloves, and many actions that are being taken by health systems globally to protect the human rights of the workers that are making these essential products for us. So as you're thinking about prioritization, to prioritize reusable products over disposables, to consider the end-of-life management, so we think of the total cost of ownership of a product, not just the price, but from the purchase through the use cost and the disposal cost, so that we favor those reusable products as we calculate cost of ownership that will be more conserving of resources, including financial resources. We look at water conservation, packaging, and waste reduction as a whole. Next, please. I'm going to shift now to talk about 2 more tools and the opportunity that you have for participating in the development of the carbon footprint calculation tool of hotspots in the supply chain that will be integrated in the climate impact checkup tool that already exists on Hippocrates in Connect, and many of you are already using. Next. As you heard from Paeng, and as you know from earlier days, next please, the health systems overall represent approximately 5% of the net total greenhouse gas emissions in the world. And among those emissions, and what you see on this slide, is a breakdown of emissions by scopes. And scope 1 emissions of greenhouse gas is those direct emissions, like your own building energy that you generate. Scope 2 is indirect emissions from example purchased energy, and Scope 3 is the emissions that largely come from the supply chain. And as you can see from our Global Healthcare Emissions Report published 2 years ago, approximately 70% of all greenhouse gas emissions come from the supply chain. And within those emissions, we see that biomedical devices and pharmaceuticals often show up as hotspots, so that we want to look more detailed at the hotspots in the supply chain so we can measure and then reduce the emissions from those supplies. Next, please. As I've said, the majority of greenhouse gas emissions are found in Scope 3, and we are looking to identify hotspots in an order of magnitude, not as granular as the climate impact checkup tool, so that we can integrate our climate initiatives with sustainable procurement and identify those products and services that represent hotspots so that we can address them with the suppliers and manufacturers. Next, please. We're looking to pilot in your region and looking for 5 or 6 hospitals throughout Asia, so a few leaders to pilot this tool and give us feedback. Next, please. The checkup tool already includes the following components in a granular or more accurate fashion for scopes 1, 2, and 3, as you see on screen. And now we're adding to the checkup tool the supply chain calculation tool. Next. Let's take a look at this tool. It is, like the checkup tool, a spreadsheet type tool. And you first, as you do with any of the Hippocrates assessments, enter your country and the year for calculation. Next. Identify the currency. This supply chain calculation is a spend-based tool. So you'll put your local currency, for example, Philippine pesos, and then it will calculate in a conversion into dollars, US dollars. Next. And we have identified the categories, spend categories, using estimations from a database called WEOD that we used in the roadmap for healthcare decarbonization that was published earlier this year, so that within the category, you identify the spend that you have, what you have procured in the last year and how much you've spent in the last year in that category. Next. The result you'll see as you go to publish the results, and it will identify and make a graph of the top 10 or 12 categories, plus the top 5 will be illustrated in a bar graph. Next. So that then you can create an action plan on how to move forward to reduce emissions. And as you've identified carbon hotspots in the supply chain, you will be then identifying and looking for who are the suppliers of that category of product that represents a carbon hotspot, so that you can work with that supplier to ask them to complete the Sustainable Procurement Index for Health. Next. So earlier you saw this same slide about the SHIPP project, and it's just to highlight again that the index, the Sustainable Procurement Index for Health, has been a key outcome of the SHIPP project, one of our major outputs of the 4 years, and it was launched last month during the Global Sustainable Suppliers Forum that was hosted by Healthcare Without Harm colleagues and GGHH members in Latin America. Next. So once you have identified your carbon hotspots and the suppliers represented, you can ask them to complete this index. And this index is globally established, recognized, and adaptable tool for policymakers, for procurement officers, for manufacturers and suppliers. And it will signal not only what your requirements are today in terms of sustainable criteria, but also your intentions moving forward, so that we can provide incentives for suppliers to improve their environmental and social sustainability record. What seems to have fallen off the bottom of the screen is coming back to those 4 theme areas that I mentioned in the first slide: greenhouse gas emissions, resource depletion, water, energy, and material consumption, particularly in the manufacturing of products, and effluent, so that the manufacturers are not polluting the community where they're, for example, producing active ingredient of antibiotics. Toxicity of chemicals in materials, and human rights in supply chain. Next. This index will support decision-making for buyers and provide a certain level of certainties for suppliers to understand what the market is like for them and what they can expect their buyers, their procurement professionals to request. It is a fairly robust mechanism and a transparent mechanism so that so the playing field is leveled. And it is proportionate in that there are levels of progression, so that you can indicate, and we'll see those levels in a moment, that I want this supplier to achieve level 1 in all 4 modules of the index. Next. So here again are the modules in the index. There are 4 modules, and within each module, they each have areas that apply to the organization as a whole, and there are questions about specific products. And for the most part, it's the chemicals and toxicity that really relate to specific products, and I'll show you that in a moment. Again, the 4 modules and the themes are greenhouse gas emissions, resource depletion, chemicals and toxicity, gender, human, and labor rights. Next. So to explain how this is structured, there are 3 main concepts. I mentioned already that there are levels, and there are levels that demonstrate progressive performance and innovation. So level 1 of the index is baseline performance. Level 2 is more detailed and progressive, and level 3 represents leading performance. And within each level are a set of modules that are linked to the 4 themes. And what these modules are questions for the supplier to answer that are linked to one of the sustainability themes. And as I said, they have a focus on either the organization, the company as a whole, or the product. And when you ask a supplier to complete the index and say which module they have to pass in order to be considered eligible for a procurement event, that they have to pass all 4 modules in that theme. All 4 themes in that module at that level. The questions are multiple choice, and the questions are weighted so you can score them. And the evidence or the verification for the answer is also included in a drop-down menu from the index. Next, please. This is designed to be used with a procurement event, a specific buying event, procurement activity. And you can see in a procurement event, there are 4 places that it might be applied when you're defining the requirements of a product that you're buying and what the criteria is, when you publish the tender or the request for proposal, when the supplier submits their answer, they submit with the results of the index, and when the buyer evaluates the supplier answers to make a determination. Next. This shows the 3 levels, the progressive levels, and 4 modules, 4 themes, so that you can see that there are a number of questions and indicators within each level and each theme. And just take, for example, greenhouse gas emissions. At level 1, there is 1 set of questions. At level 2, 2 more sets of questions. And level 3, progressively, it goes from requesting scope 1 to requesting scope 3 emission reporting and transparency of same. Next. This is what the Excel-based tool looks like. The page on the left is the scoring page, and the page on the right is an example of the resource depletion questionnaire. We'll look at the first level of greenhouse gases next. Here you can see level 1 of greenhouse gas emissions. Do you measure your scope 1 and 2 greenhouse gas footprint? And then there is a weighting that the answer to this question gives you half of the points to pass this module. You get no points for a no answer, and you get full points if you follow a recognized methodology accepted by the World Resources Institute from the Greenhouse Gas Protocol. And you also get points if you follow another methodology, but you need to document that. And then the second half of level 1 for greenhouse gases, are you reporting your emissions, and do you publish them internally, or are they publicly available? Next, please. We're going to look at the chemicals questions. And here we're looking at levels 1, 2, and 3 of the organizational questions on chemicals and toxicity and their transparency. So the chemicals questions have to do with the application of various restricted substances lists. And for the organization level, the organization questions, the first level is the European Union chemicals of high concern. And if you're familiar with the Healthcare Without Harm UNDP publication on chemicals of high concern, you will have the listing of all of those chemicals. Another alternative that a supplier can complete the chemical footprint project survey or an equivalent to that. You can see in level 3 that we're talking also about the manufacturing level of a manufactured restricted substance list and public disclosure of the weight of chemical substances added to products. Next. This is looking now at the product level. As I said before, that most of the product level questions are around this area of toxicity and chemicals. So level 1 are the environmental instruments or environmental conventions, including the POPs Treaty, Persistent Organic Pollutants, Mercury Convention, the Chemicals of Concern published by WHO, the Montreal Protocol on Ozone Depleting Substances with its Kigali Amendment, and the pesticides listed in the Rotterdam Convention. Then level 2, what you see is a number of criteria and restricted substance lists that have been produced by Healthcare Without Harm for healthcare products in particular. And you may be aware of the new glove guide that we published earlier this year and identified the fact that there is an overuse of gloves, particularly in immunization campaigns, where the World Health Organization and the U.S. Centers for Disease Control both say it's unnecessary to wear gloves when administering vaccinations. And when we overuse gloves, of course, that means we have an excess of waste, and we've also wasted the resources. On the right side are a number of eco-labels or certifications that can be used by the supplier of the product to say whether or not their product meets the standard. For example, the Nordic Blue Angel standard in Germany or the Nordic Swan standard. Next, please. This is Coming up on my last slide, and I want to thank you all for your attention and to share with you the major successes of the following 4 years in the Sustainable Procurement Project, and many thanks to the colleagues that are participating in this conference and that will continue to advance this work in the coming years. We have 18 national and subnational policies and strategies that were developed, and you can see the countries where that was advanced. And in this region, China, India, Indonesia, and the Philippines have really made advances in policy. We have our Sustainable Procurement and Healthcare Guide on screen. You see that, the guidance document developed and then has been implemented with training in a number of countries. We have profiled countries for COVID waste management, and we have identified products for substitution and supported you to implement the alternatives. Next slide. Again, thank you all very much for your time and attention, for your work, and for your leadership, because the work that you do in the Asian region is a very important leadership for the rest of the world. And in just one example, initiated in the Philippines and in Indonesia, was work on plastics, plastic audits and identifying safer plastics in healthcare settings. And that work has been taken up now by our colleagues in Europe, by our colleagues in Brazil, by our colleagues throughout Latin America, and next year our colleagues in South Africa are all learning from your successful work and your pioneering work. So thank you for that, and thank you for everything you will do next year.
Thank you very much, Susan, and I hope you can see the applause that we're getting from our participants this afternoon. So you've seen how what our SHIPP project has done over the course of 4 years. As I mentioned, this is a 4-year project that Susan shared with us. So what it has been doing, what it has done so far, and what it will continue to work on, and what it will leave our partners with. But before I let you go for now, Susan, and Susan will be staying with us for our Q&A later, I just have one question for all the members out there or network partners who are joining us this afternoon, who will be hearing SHIPP for the first time. So if I, for example, am a member or I belong to a hospital that's going to hear about SHIPP for the first time, Susan, and I'm not very much aware of the climate crisis and how it links with our health work or with the SDGs or all other environment health issues out there, at the very least, can we say if SHIPP can give them economic savings, or if not, maybe added income if they try to pursue it? Will that be also an incentive of pursuing SHIPP for the first time?
Thank you, Paeng. And yes, indeed, many ways that we look at the energy efficiency. One very small example that will save money is shifting to LED and more energy efficient lighting moving forward. As we identify energy efficiency standards for biomedical devices, which don't exist yet, we'll be able to buy more efficient X-rays, and so therefore our use of energy and our savings in money will occur. I spoke earlier about a tool that we have called the total cost of ownership. And we have some very interesting case studies from Colombia, where they switched to a reusable mask that was also less toxic. And while the price of this mask was more expensive than the disposable one, over the 100 uses that the mask had, they saved money and they protected health in the long run. And we similarly have a case study about super cold refrigerators, that when you choose the more efficient and sustainable product, that in the long run it saves money.
Thank you very much, Susan. So hopefully that encourages all the our participants out there who's heard SHIPP for the first time this afternoon. I hope it teases your curiosity. I hope you join us in our SHIPP on board in the next years as we try to scale up our project SHIPP. No? So thank you for now, Susan. I do hope you can stay with us for more questions from our participants this afternoon. So for all our participants, please punch in or type in your questions to Susan. And our next part will be also discussed by another partner, but she won't be able to join us this afternoon. But Susan can also try to answer some of your questions for that session later. So for now, again, join me in giving Susan a round of applause. Thank you very much, Susan. So for now, you can leave this stage, and I will call you back again for our Q&A. Thank you very much, Susan. Salamat ng madami. So now we go to our next part, and before I do that again, if you have any questions to Susan or any questions relating to the next discussion, please type in your questions. Please make use of our chat box. And also, I'd like to announce that some of the materials that we've shown this afternoon are in the chat box. There's a link that our chat moderator has provided, and they're also available in Bahasa. So if you want to understand that in your own language, especially in Indonesia, you can click on that link so you can access the document. Okay, so our next speaker is also where she is right now is late in the night, so she won't be able to join us. But she has been a long-time partner and one of the important, pillars when it comes to health and environmental work, not just in the United States, but also globally. So she's been a long-time partner of Healthcare Without Harm, and she's here to join us to talk about our chemical guidance document. And she is our senior strategist for Healthcare Without Harm. And I'd like to call on Tracy Easthope to discuss the chemical guidance document. So again, she won't be able to join us, but she sent us a video to share with you guys what this chemical guidance document is about. So let me call now our stage director to please play the video.
Thank you so much to the organizers for inviting me to introduce our new chemicals guidance document, and hello to all of the participants. My name is Tracy Easthope, and I'm a senior strategist with Healthcare Without Harm. The Global Green and Healthy Hospitals Network has identified 10 areas of impact to protect health and reduce the environmental footprint of the healthcare sector. This guidance document is meant to provide tools and resources for health facilities to work in the area of chemicals reduction. Toxic chemicals used and generated during the life cycle of products have contaminated humans and the environment worldwide. Exposure to toxic pollution is now estimated to be the largest source of premature death in the developing world. Nearly all nations suffer an epidemic of chronic diseases with strong links to environmental factors. The manufacture, use, and disposal of hazardous chemicals has created a crisis that also poses a global threat to human rights. Coupled with climate change, chemical contamination can exacerbate and accelerate impacts to the ecosystem and human health that threaten the basis of life. Populations vulnerable to hazardous chemicals and materials used in healthcare include patients, clinicians, environmental services workers, and other employees in the healthcare setting. But factory workers that manufacture products, workers in waste disposal facilities, and people who live near mining, manufacturing, or waste disposal sites can also be exposed. In some countries, healthcare workers have the highest prevalence of asthma of all professions. Healthcare also generates an enormous amount of waste, which increased dramatically as a result of the pandemic. Improper waste management of chemicals of concern can also threaten public and environmental health. All of these impacts are impediments to achieving several of the UN Sustainable Development Goals. Therefore, reducing and managing toxic chemicals should be a priority area of action for the healthcare sector. I'm going to provide a short overview of the guidance document. You can see the table of contents on the screen. I'll cover 4 sections of the document in this brief overview: how to start, important concepts, priority chemicals and materials of concern, and the appendices. This document focuses on just one component of sustainability. Of course, working on chemicals of concern should happen in the context of a comprehensive program that addresses all aspects of sustainability, including climate, waste, and social issues. An important companion to this document is the Sustainable Procurement in Healthcare Guide, which offers a roadmap to develop a sustainable purchasing strategy. While some in the audience may have been active in sustainability for years, others may just be getting started, and welcoming new people to the work is really important. Knowing how to begin can sometimes be the hardest part, so we've compiled a few ideas to help you get started, including things like researching the initiatives that are already underway at your facility or finding champions that share your interest in the work. The second section of the guide is an overview of some important concepts to consider when working towards safe chemical substitution and management in healthcare. Identifying and labeling chemicals is a fundamental building block of health safety and sustainability. It supports the development of a safety culture, facilitates proper disposal of products to protect the community, and helps with the prioritization of hazards to protect patient and employee health and promote safety. Substitution, another important concept, means replacing hazardous chemicals with demonstrated safer alternatives to protect public health and the environment. An alternatives assessment is a step-defined process that healthcare purchasers, supply chain managers, occupational health specialists, and others can use to make more informed decisions about the substitution of chemicals of concern in products or processes. Occupational safety and health professionals use a framework called the hierarchy of controls to reduce workplace hazards. It is a widely accepted system promoted by most safety organizations. The hierarchy places the highest value on completely eliminating a hazard rather than relying on workers to reduce their exposure. Each of these concepts are explored in more detail in the report. The majority of the guidance document is a discussion of the 6 identified priority product categories of concern in the healthcare sector. The categories are mercury-containing products, sterilants and disinfectants, safer cleaners, hand hygiene and gloves, integrated pest management and pesticides, and safer medical devices. Other GGHH impact areas have a lot of overlap with chemicals, including pharmaceuticals and buildings, which are not covered in this guide. Guidance documents and resources for those areas are available through the GGHH portal. Each of the 6 chapters contain these sections. There's a rationale describing why it is important to prioritize the category. We discuss important considerations when contemplating work in each area. Each chapter includes a hazard summary and alternatives chart. We provide tools and resources to help guide your work. And finally, there are links to case studies illustrating successful projects. A major goal of the guidance document is to collect existing resources in one place so they are easily accessible. The first chapter is about mercury-containing products. Mercury continues to be a critical focus of efforts to reduce chemicals of concern in healthcare and the target of a global treaty, the Minamata Convention. Mercury in some forms is toxic to the neurological system and can threaten the developing brains of babies exposed to it. Mercury is still used in healthcare, although much progress globally to reduce use has been made over the last decade. The World Health Organization continues to identify mercury as one of the top 10 chemicals of major public health concern, and UNEP has targeted reducing methylmercury in the environment as a major global priority. The chapter compiles the many tools and resources that have already been developed. More than a dozen case studies on mercury elimination and safer alternatives from at least 8 different countries are also referenced. Sterilants and disinfectants are widely used in healthcare and are essential for safe clinical care, but the ingredients that are so effective at disinfecting surfaces, medical devices, and materials can also pose a variety of hazards to human health and the environment. These agents are necessarily toxic to living organisms, so they can contribute to occupational health hazards, environmental threats, and the spread of antimicrobial resistance. The chapter highlights some of the most important chemicals of concern, like glutaraldehyde and ethylene oxide. It also references a recent project by Healthcare Without Harm in SciCam that evaluated current disinfectant use and investigated safer alternatives. The chapter highlights tools and resources and includes substitution case studies. Cleaning is the foundation of infection prevention in healthcare, but some common cleaners can pose hazards to patients, employees, and the environment. Cleaning products can contain corrosive chemicals, for example, that may be harmful if splashed in the eyes or on the skin. Mists or vapors can irritate mucous membranes. Volatile chemicals can lead to eye and skin irritation, headaches, breathing problems, and other health impacts. Healthcare facilities are unique in that a large portion of occupants are sick, immune-compromised, or particularly vulnerable, but employees and visitors can also be exposed. Healthcare facilities throughout the world have successfully implemented safer cleaning programs while maintaining the effectiveness of their infection prevention and control efforts. The chapter highlights some of the most important chemicals of concern in cleaning products. It links to tools and resources to evaluate alternatives. The chapter features case studies from 4 different countries. Hand hygiene is universally recognized as the first line of defense against infectious diseases and a critical infection prevention strategy. However, some common ingredients in hand hygiene products can pose hazards for the environment and people, including chemicals like triclosan and triclocarban. This chapter provides resources to help evaluate alternatives that still adhere to infection prevention requirements. The second section of the chapter covers gloves. Gloves are also crucial for infection prevention. They are among the highest volume disposable products used in healthcare. Glove use increased dramatically during the pandemic and is expected to nearly double in the next 5 years. Some materials used in gloves are associated with chemicals of concern throughout their life cycle. Some glove additives can pose hazards. Resources that provide information on the evaluation of alternatives and guidance on proper glove use are referenced in the chapter. Controlling pests in healthcare facilities is important to prevent disease transmission and maintain cleanliness, but almost all pest control chemicals pose health risks. Studies suggest that pesticide use represents an ongoing global health threat. Many healthcare institutions use chemical pesticides on a regular basis, both inside and outside the facility. An alternative to the use of pesticides is integrated pest management, or IPM, an ecosystem-based strategy for pest control that seeks to eliminate the need for the use of pesticides by focusing on the long-term prevention of pest infestations. Actions include improved sanitation, building maintenance, mechanical and biological controls, and the elimination of environments conducive to pests. The chapter provides tools and resources that guide the implementation of an IPM approach and includes links to case studies. Finally, while critical and life-saving, some medical devices can contain chemicals or materials that pose risk to human health or the environment. We have focused primarily on 2 materials widely found in plastic medical devices. PVC, polyvinyl chloride, or vinyl, is a high-volume plastic used in a range of medical devices. Each step in the life cycle of PVC is associated with chemicals of concern, including the potential leaching of toxic plasticizers during use. Bisphenol A is also a high-volume chemical used as a building block of plastic. It is widely used in products in healthcare. Exposure in the general population is nearly ubiquitous. Bisphenol A is an endocrine disruptor and has been linked in some studies to human health effects. This chapter provides information on medical products to consider prioritizing for substitution, as well as tools and resources to help assess alternatives and successful case studies. There are 4 appendices that provide support for implementation. I'm going to summarize each in the next slides. Appendix 1 is an outline of substances of concern and priority products in the healthcare setting. It includes product areas not covered in this guide, including electronics, lab chemicals, flooring and furnishings, and developer liquids, for example. Appendix 2 suggests roles and responsibilities for various positions as part of sustainability efforts within a facility. For example, it suggests possible roles for infection prevention, clinical, and maintenance staff. Those roles include conducting research, holding trainings, and developing and implementing policy. Appendix 3 provides a checklist of possible integrated pest management practices for a healthcare facility. For example, suggestions include conducting a walkthrough audit on a regular basis, logging and addressing all pest sightings, and promptly unpacking and recycling cardboard and wooden pallets. Appendix 4 outlines steps to help create a structure for taking action at your facility. The elements include identifying a working group or team, prioritizing areas for action, creating a baseline, conducting an audit, piloting alternatives, and measuring progress and celebrating success. So that's the quick summary of the guidance document. The guide and all of the GGHH guidance documents are available to members via GGHH Connect and downloadable. Comments are welcome as we hope to update and improve the guide over time. Thank you so much.
Thank you very much, Tracy, for that discussion on the guidance document. So what we heard this afternoon so far is a discussion or an emphasis on what GGHH has been doing and how the other programs such as SHIPP have been contributing to the furtherance of the goals of our GGHH 10 goals. No, so that's so far what we've discussed this afternoon, and it shows you also the discussion of Tracy shows us why there is a really need to focus on certain items in our hospitals, specifically chemicals, in terms of reducing, managing, and handling those chemicals. Because as she said in her discussion, what makes them effective as items to be used in our hospitals is also the very reason why they're also potentially dangerous to our health. So there really is a need to focus on them so that as we make sure that our hospital environment is healthy for its staff and its patient, it's also not dangerous to the health of everyone who uses it. So that's what we are trying to do in managing chemicals in our health facilities. So we now enter into the discussions with our panelists. So let me call on Susan again. Susan, are you still with us? So we can enter into the Q&A with our participants. So again, if you have questions to Susan and Tracy, Susan will try to answer all the questions this afternoon. But I have now 2 questions with me, Susan. Over the course of this pre-GHAC, we've had participants from Australia, India, Indonesia, Nepal, Malaysia, Philippines, and Vietnam. So a lot of those countries, Susan, especially during the pandemic, are feeling the loss or the limitations of their resources. So it's really a big challenge for them to stretch whatever resource they have in order for them to continue operating in the situation that they're in. For the members of our participants right now coming from those countries who are interested to rope in their health facilities. So talking about doctors amongst our participants or nurses or other health staff who would want to have their health facility join or take the challenge of SHIPP. How do they begin? Where should they begin, or how do they begin, or should they begin to convince their hospital administrators or their fellows in their hospitals?
Thanks, Baying. And I think one of the ways to begin is to look at and identify what you're already doing that's successful. And for example, most facilities in the countries that you describe have ratified the Minamata Convention on Mercury and have already done a great deal of work. Philippines is an example of providing leadership that led to the implementation and the ratification of the convention. So that work done to substitute mercury-containing measuring devices with the digital and equally effective devices, that is an example of sustainable procurement. And part of the work that led up to that was identifying money saved when you're no longer breaking and needing to replace thermometers, and of course exposing the community to that mercury. So again, start where you already have success. I would say nothing succeeds like success, and build on that. And if you take a look at the Sustainable Procurement Guidance document, Sustainable Procurement in Healthcare Guide, it is aimed at both the audience of our sustainability coordinator, who may not know about how the health system or the hospital buys products, and it's also aimed at the supply chain and procurement manager. And depending on whether it's from the sustainability perspective or from the supply chain perspective, the sustainability focal point needs to learn how products are bought, needs to find out who the people are that are making the decisions, needs to find out who among the leaders in their facility already has a commitment to the environment and to sustainability. And it's very interesting when in South Africa, the sustainability coordinators went to find the procurement officers, what they found was there was a procurement officer that was recycling the paper in their office. And so they engaged with them about what they were already doing. And it turned out that they were vegetarian, and they were vegetarian because of commitments to health and to the environment. So getting to know who's responsible, and then developing a core group of those who are interested to take the work forward, to then analyze what are the existing policies and strategies that already include waste reduction, that already include looking at the total cost of ownership for savings. So building on existing work. And in the guide itself, and you're muted, Paying, so I can't hear you, there is a kind of step-by-step guide to how to get started. And there's also what are the 10 elements of a best in class. And in my presentation earlier, I was sharing the questions that come from that 10 elements of a best in class sustainable procurement program.
Yeah, thank you. Thank you for that, Susan. Yeah, I agree. You really have to look at the low-hanging fruit, so to speak, to make it easy for you guys to transition, right? And that's really, simplifying the things that they need to do at the beginning, before they endeavor on more complex SHIPP practices in their hospital. So it's really taking, as you've said, taking the first step towards that direction will really, really help. And there's a comment, as I was saying earlier, Susan, there's a comment here coming from Taiwan, from Dr. Mingnan Lin. And he said the problem that we face is that most of the suppliers did not calculate the carbon footprint of their product. So it's either they don't know how to do it or they're not willing to do it. Yep. Or, yep. Any comments on that? Is that a prevalent experience throughout SHIPP?
I think it is changing rapidly. And we know that during the recent UN climate talks in Glasgow in Scotland last month, that a number of countries, 54 countries now, 52 during the COP, have joined the Climate and Health Program, saying that they will measure and reduce their emissions and pay attention to resilience of health systems. But also during the COP, which has not been promoted quite as widely, there was the announcement by the World Economic Forum of the private enterprises, many of whom are healthcare suppliers who have joined the race to zero. And as you probably know from earlier sessions this week, that Healthcare Without Harm has been deputized by the UN Framework Convention on Climate Change to lead the race to zero for non-state actors in the health sector. So we're leading, having health systems, all of you come on board to the race to zero. And the race to zero says that you will make a commitment to measure and reduce emissions, including Scope 3 emissions. Now, I think it's important to think about and to recognize that what is Scope 1 or Scope 2 emissions of a producer of a product will be the Scope 3 emissions for a hospital. So we'll be careful not to double count. But there's many now opportunities for engaging with suppliers to get them to measure their emissions. And of course, for them, it saves money. If they change the way they manage their energy, if they use solar energy and not coal or other energy generation to supply their factory, they will save money and save carbon. And I think actually the suppliers are further ahead of most health systems in this way.
So how do you, just to add to that, Susan, so how, especially in our region, where we've experienced double standards from certain suppliers, so it's not just in other supplies, but even as for example, simple supplies like plastic. So there would be different standards from developed countries and certain standards here in developing countries. How do we ensure that members of the SHIPP would have same access or privileges that are enjoyed by network partners from other regions in our own region?
That is a very important question. And it is interesting how suppliers will essentially try and dump their product that is less sustainable or less quality in places where the supply chain either doesn't have the resource or the knowledge. So what we are trying to do in SHIPP, and we're doing this slowly and progressively, is to develop a leadership network of health systems who want to work together globally to say, this is the criteria, this is the standard we're setting, and we will compare and identify who are the suppliers and manufacturers we have in common so that we all go together across regions to that supplier. And we've had this experience before. We had the experience 20 years ago where suppliers in Europe were providing less toxic intravenous materials than they were providing to the US. And they were telling us that it didn't exist in the US. And because of a Healthcare Without Harm Europe Clean Med conference, we saw the suppliers in Europe, in Vienna, promoting a product that the Vienna Hospital Association was using. And so we confronted the supplier and said, bring it to the US. But very interesting, that same supplier was threatening one of our member hospitals earlier this year in South America when they were asking for the more sustainable product. So it's so important that we work together in this way, that we collaborate, that you in the region may develop a countrywide supply chain transformation network to do this and then link up with the global network. And when we, for example, in this year, we've done a lot of work on gloves. And with COVID, we've all started to use more gloves and waste more gloves. So we did a survey that included all of your hospitals to identify the common manufacturers, common suppliers of medical gloves. And they're really, in the glove industry, there are 5 main suppliers of gloves worldwide. So we identified them, and now we are working with the suppliers who are responsive to say, if you meet our criteria for gloves, the entire GGHH network will buy your product.
Susan, Dr. Lin has a follow-up question. Is there an audit program for suppliers? And I think what he means by this is that do we scrutinize their product as well and make sure that suppliers report on what they really say, and for us to be able to validate whether or not those are true?
Yes, within the Sustainable Procurement Index for Health Greenhouse Gas module, there is a list of accredited auditing programs or accredited systems that the supplier can use to verify their emissions. And you'll see when you open up the index, the whole list of what are those methodologies and what is the verification for them.
So I'm now going to another direction altogether, Susan. So we focused on health facilities and then now on suppliers. Now I'd like to touch on another direct question sent to me on the government role itself. So what and how critical do you think is the role of government in pushing for sustainable procurement in the health sector? And as a follow-up question, are there any examples of government-led initiatives on sustainable procurement?
Good question. And this is partly why we are working together with the UN. So we're working from a top-down approach with the UN, who works directly with governments and can convene governments to recommend and evaluate policy. And we're working from the bottom up through the Global Green and Healthy Hospitals for you to demonstrate with your case examples that it's practical and possible. And by doing so, we give the evidence that it is reasonable to implement policy, and we have then the imprimatur of the UN to support governments. But the answer to your question is yes, it's very important. And it's very important that everyone is applying. We have one planet. There is no planet B. And so as we implement standards that become government requirements that have compliance mechanisms and enforcement, that everyone will be working in the same way to protect health and to protect our planet. And examples, there's the Healthcare Without Harm, together with UNDP, are the health co-chairs for the health sector of the UN One Planet Sustainable Public Procurement Program. And within that program, there are many countries that have implemented sustainable procurement policy. And what's interesting, however, is also in those countries, they haven't applied to the health sector. So we've been working through the One Planet system to say, what is it that sustainable public procurement leadership has done that applies directly to hospitals? Maybe it's how you buy computers. Maybe it's how you buy recycled paper. What is it that is being done by sustainable public procurement policy that needs to be adapted for our humanitarian setting? And what do we do uniquely? For example, buying anesthetic gases, that is a potent greenhouse gas, or looking at the chemicals in disinfectants that are hazardous to human health.
Unfortunately, we have one more question to entertain left because we are running out of time. And sorry for those of you who sent us other questions, but I'd like to read this last comment, Susan, if I may. And it's coming from Ricky Ronaldi from Indonesia, but I think now he's based in the US, if I got that right. And his comment is that I think the inputs from this GHAC should be delivered to the Association of Hospitals in each country, as well as the Committee of Hospital Accreditation. So I suppose that's the government side. Because usually they conduct Hospital Expo annually that many industries will get involved in that expo. So this requirement should be the mandatory for those industries if they need to sell their products to hospitals. And the question now is that possible?
Of course it's possible. With your help, we can make it possible. You know the leaders of the hospital association in your countries. You can go to their conference. You can present at the conference. We have many years provided presentations at the International Hospital Federation, which is the umbrella organization of hospitals globally. We have also established standards through quality assurance mechanisms for hospitals. One example being in India, that they have established in the last 2 years the first standard for sustainable or for green hospitals, and it has a module on sustainable procurement. So, and there is new interest at the International Hospital Federation that our global climate team is working with them also to join the race to zero and to support their member hospitals to be more effectively engaged in this work.
Thank you, Susan. So unfortunately, again, as I've mentioned, we're running out of time. Actually, we went over time. So I'm so glad about the participation of everyone. And thank you, Susan, for, again, generously giving us your time, considering that it's very late where you are right now. So I'd like to invite everyone again to please give Susan a round of applause. Thank you very much for your generosity, Susan, and for entertaining all the questions and comments from our participants this afternoon. So before Susan leaves us this afternoon, so I expressing my thanks to her, I'd like to again remind you that after our session, we'll be tackling how we will activate the health sector as for our climate and sustainability advocates and as becoming champions. So Susan, thank you. And you may now leave the stage and you may now take your well-deserved rest. Coming from all of us here, thank you very much. And we hope when we conduct the GGHH conference in India next year.
Thank you. Congratulations.
Yeah. So again, thank you very much. Another round of applause for Susan, everyone. So the discussion this afternoon, again, focused on what GGHH can zero in on, and that's procurement or purchasing, as we've discussed. And we took a deep dive a little bit on some of the materials or items in our hospitals that sustainable procurement can focus on. And I'm talking about the chemical guidance document that Tracy, after Susan, shared with us. So this basically shows to us, I hope, that the things that we want to happen as a health champion, wherever we are right now, if before this afternoon you felt like you're alone, I hope now you feel like there's a broad network, a broad movement of health champions out there that wants to work with you and are actually trying to do what you're doing also wherever you are. So from your own very own small clinics, you can include the hospital And I hope it also shows you that we can actually work with our suppliers and make sure that the items we purchase from them can be as sustainable as we want them to be. And also, we also talked about how we can also involve the government in the initiatives that we work with. So it basically shows us that there's a whole movement out there that's already happening, that you are a part of right now, that or you can be a part of if you're not yet a part of our GGHH network. And again, earlier I've seen how there was a link shared as to how you can join GGHH, and you may click on that link if you want to join us. The network. So there's a whole bunch of experts and experienced partners that can handhold you in whatever journey you want to do, no, or to take in greening your hospital. So the last 4 days we've discussed that you can begin anywhere you like. We talked about the low hanging fruits, and those would be the easy steps that your clinic or your hospitals or you as an individual can take to make sure that your steps as a health practitioner would be as green as possible. So with that, I will end this session so that we can transition to our next session. So our next session, as I've said, we'll discuss on how we can activate the health sector as climate and sustainability advocates and champions. So I'd like to call in now our moderator for that session. So I'd like to call in the very energetic, the very bubbly, and what can I, very, she just burst with energy. So I'm really happy that she'll be moderating our discussion this afternoon. So I'd like to call Miss Lady Dapat, the Marketing Director of Adventist Medical Center, Philippines, to moderate our session this afternoon. Miss Lady, are you with us already? Can you join me up on the stage? I can see that she's trying to join. Can our technical team may I call Aaron or Pats to help Miss Lady? So there's a recommendation here, Miss Lady, if you can hear me, to refresh your browser. So that might help. Okay, that's stable now. Can you turn on your video, Miss Lady? So while we're waiting for this lady to join us this afternoon, so I'm inviting all of you now. So can you type in our chat maybe 2-3 words, takeaways from our discussion this afternoon? So what have you learned so far, or are there any takeaways, or are there any like decisions that you thought like you would pursue now that you learned about it in the course of our 3 days or 4 days so far? Please join me. Please use the chat box. Type in your takeaways. Let's read it while we're waiting for this lady to join us. Anyone from our participants from where? We have participants from India, Taiwan, Philippines, Indonesia, Vietnam. Anyone, any takeaways that you would like to share so that other participants can also read them? So Miss Lady is still having technical difficulties. Is anyone helping her right now? Okay. Thank you for sharing. Uh, make it happen. So let's make healthy environment happen. True, very true. We can't live as healthy people in a very sick environment. Thank you for that, Ricky. Any other takeaways from other participants? And thank you, Pats, for getting in touch with Miss Lady. In the meantime, we'll use this moment to exchange thoughts and notes and learnings from our 3 days. Any other any other takeaways from our participants, or any decisions probably that you might be having right now that you will start pursuing based on what you've learned so far in the last 4 days?
Yes.
We have it. Okay. Thank you, Miss Lady. You made it. Okay. So I'm going to leave the stage now. I've introduced you. I hope you've heard how I introduced you
I heard
earlier.
you. I heard you.
Okay, good.
I was here a while ago from the start, and why can I go to the stage? So the good technical team of the GHAC instructed me to restart the browser, and now I'm in.
Thank you. Thank you. So we'd like to thank our technical team for making this happen. So I'm now going to leave the stage, Miss Lady, and I'm going to invite again everyone before I go down the stage to give Miss Lady a round of applause. Thank you very much. Take it on, Miss Lady.
Thank you so much, Sir Paeng, and to our speakers for those presentations. I personally learned a lot, and that was a very wonderful discussion that you had before you transitioned to me. Thank you, Miss Susan, for that. So to everyone here, greetings wherever you are across the globe. And again, thank you for joining the GHAC Pre-Conference 2021. I cannot imagine that today is already our day 4, the closing session. And for those who haven't watched all of it, I feel like I want to request a copy so that we can rewatch over and over and learn, and also show to other people on how we can make the world a greener, better place. So today, the closing session is going to be on sustainable procurement and healthcare advocacy and communication. So before we move forward, again, thank you, Sir Paeng, for introducing me. I'm Lady without Gaga, but I'm a fun girl, and I'm from Adventist Medical Center, Manila. And if you haven't heard of our organization, we have always been a proud member of the Global Green Healthy Hospital since September 2018. And our organization is here at the heart of Metro Manila in the Philippines, in the city of Pasay. And one day, if you come here, if you visit and all is safer, just please buzz me, and I'll be so glad to accommodate you, as long as, you're from GGHH and GHAC, then we're already all friends. Now, let me share with you what's gonna happen for the next few minutes. The closing plenary session we will revisit and know the highlights of how we can move forward from all the things that we have heard on the 4 days. And the session will also feature a panel of climate and sustainability advocates, champions, to explore innovative insights on how health professionals can act as trusted and effective climate communicators, advocates, and champions. So without further ado, let us go to the panel discussion on advocacy and communication. Let me start by introducing to you the panel members. So, all right, it's always, it's just fitting to have them as our panelists this afternoon to close this 4-day Green Hospitals Asian Pre-Conference. They are going to kick off the dialogue on how hospitals can become examples of sustainability and equitable, climate resilient institutions to practice, and also as advocates and communicators. So, let me just tell you that I'm really personally inspired and excited because since we have been a member of the GGHH, we were able to spark advocacies here at the hospital, and it kind of affirmed our practice because if you don't know, we are only serving vegetarian and plant-based food here. Never in the 90, is it 91? In the 92 years of existence did we serve beef or chicken or things like that. So we're all for the healthier part. And GGHH, the GAHAC, made us, realized how that practice is really helping the environment. Thank you so much, GHAC. And of course, in using LED lights and reducing the single-use plastics and all of those things. So now, let's move forward. We have invited sustainability and climate resilient champions from the Philippines, Indonesia, Singapore to join us in this discussion. So first, let us all warmly welcome Dr. Ronald Law, the Director of the Philippine Department of Health Emergency Management Bureau, and an active member of RISE, Southeast Asia Alliance. Dr. Ronald Law. Next, we have with us Mr. Donald Y., the Director of the Hospital Planning and Infrastructure, as well as the Chair of the Green and Sustainability Committee of the GGHH member Khoo Teck Puat Hospital in Singapore. Welcome, Mr. Donald Y. And last but not the least, let us also welcome Mrs. Purwati, Head of the Promotional Department of Ibnu Sina Hospital of Gresik, Indonesia, who is really very active on social media. So to our speakers that I have mentioned, you may now click the go on stage if you haven't done it yet, and join me here on stage together with Mr. Barry, our very able translator for the plenary discussion. There you go. Good afternoon, everyone. And thank you so much for being our panelist for this afternoon. Once again, Dr. Ronald Law, Mr. Donald Y., Mrs. Purwati, and Mr. Barry. Thank you very much. Welcome to all of you. Now, let us kick off this panel discussion with our very limited time. The first question is, in your experience as a health facility, a hospital communications officer, and as a public health practitioner, what are the benefits of public health and planetary health promotion through advocacy and creative communications? With Dr. Law, who would like to go first?
Hello, good afternoon, everyone, and the panelists, and of course, our amazing moderator, Ms. Lady. So, if I can answer that question now. So, in my experience, being a public health professional, as you know, there are so many benefits that can be derived from doing good advocacy and creative communications. But I'd like to highlight three. I think first off, this can help us support the policies that we have to do, of course, for people through the government. It can support our programs. So this can give us more clarity in terms of what to focus on, because there are so many priorities. For example, in the Ministry of Health, it's very true in all of our settings. But then again, we already know that there's already a lot of evidence that has been established on what programs to do. So that include building climate resilient health systems or decarbonization of the health sector. But if effectively done, advocacy and creative communications can give the needed push to really affect urgent actions through policies that we do, and this can help us really think of and do and invest on priority programs and interventions. So this is very important. Number two, I think this will allow us to reach out to as much stakeholders as possible. And during this day and age, we have to maximize all different platforms available and be able to use effective communication strategies so we can meet the needs of different people, different target audience. So this can be, of course, the general public, our fellow colleagues, our politicians, most especially, and even other scientists for that matter. And I think on behalf of the Philippines, we think that having effective advocacy and communication can provide us with the greatest opportunity. At the end of the day, we should have a unified message talking as health people in the health sector. We should have an overarching theme or message that has the potential to unite everyone. So that has to be related to health resilience, having smart hospitals that are safe and green, and those that are future ready. Because only if we are so strong, the way we should be doing this is having a unified approach. So this will allow us to advocate within our health sector and more importantly outside the health sector until we're able to do all of the needed actions in terms of our adaptation and mitigation issues. So that's what I can share, Ma'am Lady. Thank you.
Thank you so much. I'm having quite a difficulty here, but I was hearing all that you said, Dr. Law. Thank you for those insights. Before I give my feedback on the learnings, because it's only you who answered, but I learned a lot already. Let me call on for his insight, Mr. Donald Y.
Thank you. Can you hear me?
Loud and clear.
I'm from Singapore. Basically, in Singapore, I work in this hospital, which is a public hospital. For those of you who have not heard of my hospital called Kutipua Hospital, we are actually a public hospital serving the general population. And in terms of public health and planetary health promotion through advocacy and creative communication, I think so far the Singapore government through the Ministry of Health has been rolling out a lot of programs. Okay, so for example, I think one of our concepts which I want to share with everyone is we always believe in the business of wellness care rather than illness care. So what do I mean by that? So although I work in a hospital with a lot of doctors and nurses looking after patients, our main focus is to follow up on the well-being of the patients that have been discharged. We just don't want to sort of like look after the patient who come in the hospital, and after that, when they are discharged, we just say bye-bye, and hope that they don't come in again. So what we do is we have a department called Population Health. And the Population Health Department in our hospital also looks after discharged patients. So our nurses and doctors will visit the patients after they are discharged on a very regular basis to go to their homes. We want to make sure that we check whether they take the medication, whether they are eating properly, whether they are having proper exercise, and whether they are looking themselves. Because it's no point just treating them in the hospital and leaving them to go home, and after that we don't know what happened to them. End of the day, as I mentioned, we want to be in the business of wellness care rather than illness care. So our government has given us a lot of funding support to go beyond looking after the patients within the hospital. And to do that, we have a very big team of this staff, as I mentioned earlier, the nurses, doctors, to visit the patient. So Singapore is of course not as big as Philippines. I mean, from what I know, it's even smaller than Manila. So the point is that we want to make sure that the patients follow a regime or follow a set of regulation to make sure that they look after themselves. And we feel that it's not just about us, it's also about going green, interacting with the environment. So what do I mean by that is that we always try to enroll or to invite these former patients to take charge in green activities. So what do I mean by that is, for example, we encourage them to take up gardening, horticulture. We encourage them to go on programs with the community like litter picking. Okay, litter picking to keep the environment clean. And that is actually a form of exercise if you realize it. Because to stay at home and watch TV, and just to take the medication will not help them. So we are weaving in all these green programs together with our community outreach program to make sure that the patients are active and they stay healthy. So I hope that I've given a better picture of what we are doing in Singapore. Thank you.
Thank you so much, Dr. Y. You know what? When we visited the Kutek Pot, it was an awesome place, and we just admire how you have been able to put a garden inside the hospital, right?
Yes.
Have a beautiful hospital.
Yes.
And if ever I visit Singapore again, definitely I would drop by Kutek Pot.
Sure.
Because aside from the beautiful establishment, I love your food.
Yeah.
So thank you, Doctor.
By the way, if I just add one last thing, is that in our hospital we always have a gardening program for our patients in the community ward. So when they are staying in the ward, right, one of the things we always let them do is we give them a pot of plants or pot of flowers. So every morning we want them to go and look after the plant. And when they are discharged, they are actually able to bring back the pot of plant, bring back to their home and continue to look after it. So it's actually part of our green culture, not just greening up our hospital spaces to create a healing environment, but we want the patient to participate in it. Yeah. Okay, thank you.
Thank you again. And now let's listen to the insight of the only Rose in the panelist, Mrs. Purwati.
So I will translate it, the question for Mrs. Purwati. Bu Purwati, menurut pengalaman Anda sebagai petugas komunikasi dan profesi kesehatan masyarakat, apa keuntungan dari upaya advokasi dan komunikasi kreatif untuk meningkatkan kesehatan masyarakat dan lingkungan? Silakan dijawab Bu Purwati.
Terima kasih. Menurut saya sangat menguntungkan dengan kita melakukan advokasi, diharapkan bisa dikeluarkan kebijakan-kebijakan dari pimpinan-pimpinan sehingga bisa mendukung program-program yang akan kita jalankan ke depan, tentunya yang berdampak pada kesehatan lingkungan. Terutama kebijakan-kebijakan yang sangat mempengaruhi atau berpengaruh dengan berdampaknya Green Hospital. Kebijakan tersebut seperti pengelolaan limbah, pembelanjaan barang atau pengadaan barang, dan konservasi sumber daya alam. Kualitas lingkungan yang sehat akan meningkatkan derajat kesehatan, terutama kesehatan masyarakat. Pada masa pandemi COVID yang terjadi 2 tahun lalu, sampai saat ini ya mungkin belum lepas, kami berusaha untuk tetap melakukan promosi kesehatan dengan kreativitas komunikasi melalui media-media cetak atau media sosial yang mudah diterima oleh masyarakat tentunya, melalui YouTube, Instagram, bahkan TikTok kita sudah bikin, dan melalui siaran langsung tentunya, yang bekerja sama dengan Dinas Kominfo yang ada di Kabupaten Gresik ini. Dan pada saat ini kita bisa bergabung dengan Bapak Ibu di Health Card Without Harm. Komunikasi kreatif juga memiliki peran yang sangat penting untuk menyebarluaskan isu lingkungan kepada karyawan di rumah sakit kami, sehingga tenaga kesehatan ataupun non kesehatan bisa tahu tentang apa sih sekarang yang akan kita lakukan, terutama pada generasi muda kita, generasi milenial. Hal ini dapat meningkatkan kesadaran lingkungan oleh anak muda zaman sekarang, tenaga kesehatan ataupun non kesehatan kami, untuk mengubah perilaku, tentunya perilaku individu yang lebih ramah lingkungan, seperti reduksi, memilah sampah, efisiensi penggunaan air, bahkan efisiensi penggunaan listrik.
It's very useful.
Jawaban kami. Terima kasih.
Thank you, Mrs. Poor. So I will translate it. It's very useful. We expect that the advocacy that we have done will be able to emerge a policy issued by the policymakers to support our program, especially in Green Hospital, to improve the health and well-being, especially in the environmental health. Such policies include the sustainable waste management, procurement, and environmental conservation, as the healthy environments leads to the improvement of the public health as well. During the COVID-19 pandemics, in recent 2 years, we have been conducting the health promotion through the creative communications using social media, which most of the community use, for example, like YouTube, Instagram, or even TikTok, the newest, our social media, and also live streaming in collaboration with the Agency of Communication in Gresik, and also with the Healthcare Without Harm. For the creative communication, it is also have the pivotal role in our to amplify the environmental issues to the hospital community, both health professional or non-health professional, especially the youth professionals, as the campaign can raise the environmental awareness, leading to the behavioral change in more sustainable practices like waste reduction, waste reuse, water and energy efficiency.
Awesome. Thank you so much for all the insights that you have given on this first question. I found a quote that for me summarizes how you are doing all these advocacies and how it can push our government and all other people as they are inspired to live in a healthier way. According to the Chief Shuttle 1854, it's an article and it says, humankind has not woven the web of life. We are but one thread within it. Whatever we do to the web, we do to ourselves. All things are bound together. All things connect. And all of these things that we are doing using the social media, gardening, the program for wellness, for discharged patients, all of this, policy making, this is helping us to thrive in this one thread of life that we are all in. Thank you for that. That's only number one. Let's go to the next question. Here it goes. In the context of advocacy and creative communications, what are your recommendations or tips for other health institutions to use their voice in advocating for green and zero emissions healthcare? Once again, let's start with Dr. Law.
All right. What can I say? So this should be very practical. I think, yeah, you have to be part of the GGHA, attend the GHAC. So basically, I think number one, we should be part of something. Our institutions must be part of something bigger than them. So being part of a community or circle, in all of these things are being discussed and being pushed. So what better way to say that, yeah, you have to be part of all the alliances. Like me, I'm part of Rise Southeast Asia, which is a bigger level, but I'm also part of the Rise Philippines, of course. And I think we have to be part of the community or circle, so we can get access to the latest information and updates, basically about best practices being done. So when we are in touch with these people who are part of the circle, there are two benefits. We are able to share what we are doing very well to others, and we can also get inputs from them. So basically, this exchange is very important among colleagues and counterparts. That's one. I think number two, I think I also was able to pick this up in the previous panel before this. We need to be able to document our good practices. So the good thing that we are doing, it should not end with us. So the word has to be spread. The practices have to be documented. So maybe that has to be shared in a webinar like this. That has to be written by way of an article. We can publish it like a very good case study for everyone to know about and see. No, and this I think is the importance of having what we call a proof of concept. So we have to be particular that we're talking about good concepts, visions, all technicalities, but at the end of the day, all people, everyone deserves some proof of concept. We need to provide the best evidence there is in terms of what we're doing. So this will allow other people also to jump on the bandwagon if we are creating that. And that is important if we are trying to build and create a bigger movement that will create ripple effects moving forward. And then lastly, I think we don't have the monopoly of all information. And most of us will be limited in terms of our information, our resources, etc. But I think we need to reach out and collaborate with different types of stakeholders. So like me, I'm representing the government. So government, civil society, non-government organizations, and in communities. So all of this has to happen within a community of practice, a community of sustainable green healthcare practices that are all looking towards that, the decarbonization of the health sector. So I think, I have to be very practical in terms of this. And as a Ministry of Health in the country, we can only hope that we will reach this level of maturity and advancement, so much so that we can also somehow in the near future be able to compete with what Singapore has to offer in terms of these concrete initiatives. And I'm sure our colleagues from Indonesia are also gonna. So we are learning a lot from all of you, but I think we will do our best also in terms of showing what we have to offer. Like the Philippines, you know for a fact that the Philippines is always number 1, 2, or 3 in terms of disaster risk. But at the end of the day, we don't like to be projected like that always. We are the 7-Eleven, 24/7 for disasters like this as problems. But of course, all countries, I would have to say, would not want to be famous for that. So we also like to be famous for doing the right things, for making sure that these solutions that we're talking about here are also being done. So they really they provide benefits for all the people to enjoy, for the current and future generations to come. So thank you.
Thank you, sir. That's awesome. Okay, now let's hear from Sir Y.
Hi, Mr. Donner has stepped out to attend some urgent meeting. So I'm Aidan, a colleague of Mr. Donner, also part of the Green Committee of Kuttipa Hospital. So I will answer the question on behalf. So in our hospital context, on top of providing hassle-free medical care to our patients, we also believe that having a green and healing environment do also enhance the healing effect that we provide to our patients. So we set up we have a committee that look into how do we raise the awareness of green health promoting, not only to just patient, to our staff, and also to the NOKs, that means the next of kin or public that will come into our hospital. So we always believe that instead of using long words, that we believe in more visual effect, means pictorial and striking posters and light colors that will catch people's attention when they walk into the hospital. So we believe that instead of telling them that we provide this healthcare, we educate them through the ways that how do we keep the environment green, and how do we take care of ourselves in our normal daily life. So all in all, we try to incorporate our education to align with their daily life. For example, when they go into the food court, we promote to them that they will look at vegetable first. So how we arrange the sales of our store is we put the vegetable more upfront, and then the meats one is all at the back section. So once they have select all the vegetables, they say, hey, my plate is quite full already. Then the meat portion one, they will cut down. This is how we what part of it. And then for sugary drinks, so our drink store at the eye level is always those healthier drinks. Those sugary drink will be more at the off their eye level. So this is how we promote them. And in terms of green and sustainable, our committee do work closely with our government agencies to align with them with their events like the picking, Clean and Green Week. And then we do share information that they do have posters that we use, and then we promote, we will display around our hospital to promote the level of awareness. And then we also do monitor and track all of our waste, genital waste. And then we have a report every monthly. And then if the number looks a bit off, then we'll investigate and then try to educate the users, try to cut down those wasteful material, like reduce on printing and all this. So this is how we actually raise the awareness to everyone, and to try to align to their daily lives. Yeah, thank you.
Thank you so much. And last but not the least, let's hear from Ms. Purwati.
Bu Purwati, dalam konteks upaya advokasi dan komunikasi kreatif, apa rekomendasi dan tips dari Anda untuk pelayanan kesehatan, untuk menyuarakan advokasi pelayanan kesehatan bagi Brown Hospital dan pasienkes nol emisi?
Terima kasih. Menurut saya atau saran saya bagi fasilitas kesehatan lain, jadilah proaktif dalam memberikan fasilitas advokasi dan promosi, terutama promosi Green Hospital. Karena fasilitas tersebut sangat kita harapkan untuk di masa-masa saat ini, terutama di Kabupaten Gresik ini banyak perusahaan-perusahaan, sehingga kita harus menggaungkan Green Hospital tersebut. Dan apa yang harus kita lakukan dengan sosial media misalnya, kita bisa bikin video, poster, atau konten-konten lain yang bisa dilihat publik. Karena setiap ada inisiatif, meskipun kecil, yang berhubungan dengan Green Hospital, kami akan membantu menyuarakannya ke pembuat kebijakan dan karyawan-karyawan rumah sakit kami dalam lingkup kecil dulu. Sehingga inisiatif tersebut dapat diaplikasikan dengan regulasi dan perubahan-perubahan perilaku tentunya bagi karyawan-karyawan di RSUD Usina Kabupaten Gresik ini. Untuk selanjutnya adalah melibatkan profesional muda di rumah sakit Ibu Sina ini. Karena pemuda adalah agen perubahan yang tentunya memiliki kreativitas tinggi dan inovasi tinggi dalam memberikan pelayanan di rumah sakit ataupun perbaikan-perbaikan untuk rumah sakit, terutama dalam hal advokasi dan promosi. Tentunya kalau saat ini kita bicara Green Hospital, jadi untuk menyuarakan Green Hospital. Kami memiliki profesional muda dalam bidang lingkungan seperti Mas Bahri ini, dan multimedia yang aktif dalam menyuarakan Green Hospital dan pasienkes nol emisi. Mungkin demikian dari jawaban saya. Terima kasih.
So my advice to the other healthcare facilities is being proactive in giving the advocacy and green hospital campaign facilities, as it is very important issues, as the Gresik is one of the industrial city and we want to lead the other organizations in Gresik to be more resilient and sustainable in climate change, especially in greening their institution. Those facilities include the video, poster, and social media content and networking. So every initiative, even though it is small, that is related to the Green Hospital, we give help to promote it to the policymakers and hospital community. So then the initiative can be applied in form of regulation and behavioral change. Another tip is involving the young professionals, as the youth is the agent of change that has great creativity and innovation of healthcare services, especially in advocacy and campaign. So we have youth professionals in environment, just like me, and multimedia sector that actively promote green hospital and zero emission healthcare facilities.
Thank you so much for all your insights. Once again, I've noted a lot of things like document, link, reach out, network, because we don't have all the monopoly of information. And we should take care of ourselves and use all possible communications and platforms, big or small. This is going to contribute to all people to get inspired. And I think the challenge is I think one of the challenges is what Jennifer Nini mentioned in his write-up when she said, being green is more than just buying eco. It is an unshakable commitment to a sustainable lifestyle. So this is a challenge to all of us, because before we go into the bigger setting, one of the things is how we can live the green lifestyle, so that before inspiring another town, we can inspire our neighbor. Wow, that is a big challenge even to myself. Now let's go to the third and final question for our plenary session this afternoon. And here it goes. What are your expectations, or what are you looking for in terms of climate resilient and sustainable healthcare related advocacy for creative campaigning for 2022 and beyond? Of course, first, Dr. Law.
Okay, thank you. I think this is the deciding question, if this is a pageant of sorts. But I think, yeah. So what the recommendations are in terms of insights and tips. Of course, I will speak from the perspective of someone working for the government. So it's not about organizations not knowing about the issue, but yeah, we have to be mindful of the fact that like the government would really look at several priorities, and there are many pressing issues, COVID-19, etc. But anything can be really bumped off by COVID-19 easily. But we cannot let that happen with our what we want to happen in terms of climate change impacts on health and society. So I think all the campaigns should be considering the priorities of any government, but it has to be creative and innovative enough to and do it following right timing. Like in the Philippines, where a disaster, I mean an elections, an elections is coming, so we have to look at that as a window of opportunity to once again make our voices be heard. No, we have to take bolder actions, but in a way, it should also be able to leverage on things that are already being done. Yeah, so because we are always not starting from scratch, so it would be helpful to pick out to identify at what specific point to start on, and that has to be something very specific. So we have to make use of existing initiatives already, things like that. And then I think since it's advocacy, it should be gauged by how far and wide the campaigns, the strategies are. So I think the big challenge of scaling up. So I don't know how many Filipinos, how many Asians, no, how many people, how many global citizens are listening to this, no, and taking stock of all the good things that we are talking about moving forward. So I think any campaign should be far and wide, and there has to be very clear evidence. So if you are, of course, dealing with the government, you have to put out the best evidence out there, but in a way that is brief. So policy briefs would have their roles because, as I've said, the government is always busy dealing with so many pressing issues. And as much as we want to be proactive, yeah, we always are reactive because of the multiple incidents that are being thrown to us our way. So that's the problem in the Philippines. So we'd like to prepare for event A, today, but tomorrow event B happens, and another event C. So it goes on and on and on. So the frequency of events, the time it takes for you to really be objective and do it. So I think all of these things happen, but the key is, where do you really insert yourself when you are the advocacy guy? If you had this platform, so there has to be a lot of creative innovations. Maybe you have to utilize some people, utilizing networks, tap this celebrity, or maybe some creative ways in the Philippines that would always be appealing. Then I think yeah, so in as much as we are putting the health sector at the front and center of all of this, of course, we as the health sector would would be glad to be used, and no, in a positive way to come across the message. But I think we also have to realize that maybe as health sector, we also need the support of everyone to be able to target also the other sectors. So yeah, so health is just one among many sectors. So I think that has to be considered as well in the campaigns and communication strategies going forward. Thank you so much.
Thank you, Dr. Lo. Elections is coming up here in the Philippines, ladies and gentlemen, and I hope and pray that all these leaders who are going to have their platforms presented will consider something that's for the planet, right, Dr. Lo? I really hope and pray that they will do that. That because just like Ma'am Susan mentioned a while ago, we don't have a planet B. This is all we have. And a proverb said, we did not inherit the earth from our ancestors. We are borrowing it from our children. So, yes. Now let's give time to Mr. Y. I'm sorry, to Caleb.
Yeah, I'm Aidan, yeah. Okay, so also in terms, if you ask about what the expectation, essentially the ideal way will tell that we want the environment to clean, our people to be healthy, and the cost is low. But in real life, all this cannot be achieved if you want everything and all. So essentially, we still need to look at how we balance our wants and the cost that we are talking about. So in Singapore, government recently is pushing and promoting for green and sustainable environment, and then how can us be more sustainable and not generate more waste to the environment, because as we know, Singapore is small, and then there's literally no natural resources. So it's really important that we focus on how we can take care of our planets. Okay, so within the hospital, what we are doing, we aim to achieve is to create a hassle-free environment or hassle-free admission or service to our patients, meaning they come in, the low waiting time, the low cost, and then the area, the environment is clean and basically healthy. Healthy is the word. So the thing that we need to raise the awareness, I mean, for near future and all, is the commitment that we need to get everyone in the whole hospital to buy in that we are doing this for good for the planet and for a long run to maintain this healing environment for all of our patient staff or any public that's coming in. So we look at how we could cooperate with our government agencies to come out with campaigns that will reach out to the if you're looking at the future, will be the younger generations, educate them more on how can we be sustainable and not generating waste. And in terms of operations, we know that healthcare is one of the sector that generate quite a number of waste because we use a lot of things that's one-time usage, use and throw. So some of them we cannot avoid because due to infection control, due to hygiene purposes, we can't reuse it. But we may we can review and look into the rest of the areas, like for example, pharmacies giving out medicines in plastic bags and all. How do we reduce that? So these are things that we are working on on a hospital and aligning to our government movement to zero waste, moving towards zero waste. These are the things that we are trying to achieve for the future. So we can't achieve things like say I want to do then big bang or we achieve something very big. So we are looking at the phase, working in phase, taking small movement at one of time, and then also educating our staff to encourage them to adopt a clean and green and then a sustainable lifestyle. Because every little effort that every single one of us put in actually contribute to the big picture of a hospital and then nationwide. Yeah, so the things that we believe is you start small and you start educate and gain awareness of everyone to buy in that, so that this can be successful.
That is really right. I couldn't agree more. Start small, just do what you have to do and you can do, and of course communicate, collaborate, and cooperate. Especially if in the wider scale we have that opportunity with the government. Thank you so much. And of course, now let's listen to Ma'am. Mrs. Purwati.
Yeah.
Yes.
So, Bu Purwati,
we are ready to hear about your insights on your recommendations and expectations for 2022 and beyond.
Bu Purwati, apa harapan dan rencana Anda untuk melakukan upaya advokasi dan komunikasi kreatif dalam implementasi Green Hospital dan fasilitas kestabilan iklim pada tahun 2022 dan tahun-tahun yang akan datang? Silakan jawab.
Terima kasih. Pada tahun ke depan, kami akan lebih fokus pada advokasi dan komunikasi kreatif, tentunya pada sektor energi, terutama penggunaan listrik. Mengingat porsi penggunaan listrik saat ini di RSUD Ibnu Sina Gresik ini prosentasenya cukup mencolok. Karena kita tahu di rumah sakit penggunaan energinya di berbagai unit pasti itu. Dan untuk advokasi akan dilakukan untuk mendorong pembuat kebijakan untuk memanfaatkan energi terbarukan seperti panel surya serta regulasi memang yang kita harapkan yang sudah ada untuk memakai efisiensi energi tersebut. Komunikasi kreatif mendorong karyawan rumah sakit sebagai pengguna listrik untuk melakukan efisiensi energi sehingga terjadi efisiensi yang masif. Diharapkan emisi gas rumah kaca yang dihasilkan di rumah sakit akan berkurang dengan signifikan melalui upaya-upaya tersebut. Jadi itu dengan adanya advokasi dan komunikasi yang kita lakukan, dan selain itu beban finansial yang dikeluarkan oleh rumah sakit sendiri untuk pembelanjaan listrik juga bisa kami efisiensikan atau lebih berkurang dari sebelumnya. Mungkin itu, terima kasih.
So in the coming years, we will focus on the energy sector advocacy and creative communication, especially in electricity efficiency, Since the electricity grid has the biggest percentage in the hospital energy consumption, as every unit, every department in the hospital are using the electricity. So the advocacy are expected to push the policymakers to install the renewable energy plants like solar panel and implement the forcing regulation of efficiency energy. While the creative communication will encourage the hospital community as the electricity user to save electricity, which leads to the massive efficiency. And we expect that the greenhouse gases emitted by the hospital will become significantly lesser through those efforts triggered by our advocacy and communication that we have done. Moreover, the hospital financial expense for the energy purchasing will be decreased as well.
Thank you very much for all your insights. I wish we have so much more time, but all I can say is that I learned a lot from all of you, Dr. Law, and of course to the Kutekfat representatives with Mr. Y and all of you there, Ms. Parwati and Sir Barry. Thank you very much. I think what I can just say is that we still have hope. As long as there are people like you and people you are influencing to continue the movement, then there's a bright future for the next generation. According to author Robert Swan, the greatest threat to our planet is the belief that someone else will save it. So let's not have someone else save it. As long as we can do something, even the smallest act can contribute to the whole. Wow, the time is so short. Thank you. Thank you so much once again. And this is just the pre-conference. I hope that we will be able to listen to more of your wisdom and experiences again in the future. Thank you very much, Dr. Ronald Law, Mr. Donald Y, and the Kutekfat family, Mr. Purwati, and of course, to Mr. Barry. Thank you.
Thank you.
You may now have your much needed rest at the cafe or stay here because our next speaker is going to lead us with the GGHH members. Oh, no. The next speaker will give us the highlights of the pre-conference. So may I now call the Executive Director of the Healthcare Without Harm Southeast Asia, Sir Ramon San Pascual. The stage is yours, Sir Ramon. Thank you, everyone. Let us now leave the stage and give the floor to Sir Ramon San Pascual.
Thank you, lady, and thank you to all the panelists. We are now about to end the 4 days, not only today's session, by presenting to you the summary of what has happened over the last 4 session days, beginning last week. So on day 1, if Jit can put on my slide onto the screen. Slide 1, please. So on day 1, we talk about path to healthy recovery. Even as we had succeeding discussions on different themes. So let me talk about quickly on what has happened on day 1. This was last week in December 1. That we opened this pre-GHAC at the heels of the conclusion of the COP 26. And in the last global climate meeting held in Glasgow, health is a very central part of the whole discussion and agreed action. And this was tackled further in the succeeding days of our pre-GHAC. Now, we also had a discussion on how do we recover out of the pandemic. And the key point there is that harming the environment and changing the way we interact with the environment directly impacts the risk of new diseases emerging into the future. Thus, to protect ourselves from any further harm coming up from another pandemic, it's best that we also care not only for people, but we also care for our environment and our climate. The other takeaway is that in anything that we do in managing hospitals, in caring for our patients, there should be another set of standards that talks about environmental health and how we don't do harm to our environment by integrating environmental standard into the healthcare facilities. And that we should be able to incentivize those leaders, healthcare workers, the staff, even Ministry of Health should be acknowledged when they are able to encourage and promote and fulfill green standards in hospitals. On day 2, we talk about now the decarbonizing Asian healthcare. And we had several colleagues who made presentation one after the other, but it is enough to say that there was a detailed presentation on what exactly were discussed during the COP26 that tackled the role of healthcare, hospitals, and healthcare professionals in addressing climate. I won't anymore mention what are those portions of the discussion during the 2 weeks of COP26 meeting. But there is an emphasis on now that we're trying to innovate as we address climate, now that we're trying to go beyond what we were taught in our public health schools or even in our health schools or School of Medicines, by having innovation that link climate and health, we ourselves as the champion need to introduce these concepts to our colleagues. And this has been discussed even just now on day 4 at the bottom of the session. Discuss this matter to our colleagues, to the communities that we belong to adopt concepts of climate change and health. Thus, it is our responsibility to let others and our own colleagues who may not be yet aware why we need and how we need to push to healthcare sector to work on climate. In fact, there was a elaborate presentation of how indeed healthcare can track decarbonization roadmap. And this is applied on systems in healthcare at the country level, even in the healthcare system level. In day 3, we talk now about resilience, the impactful stories for sustainability and climate resilience in healthcare. And there was a very dynamic panel discussion at the beginning of day 3 that pointed out that policy set up at national and hospital level is key factor, together with building capacity and awareness, so as to facilitate resilience. So we talk about the need for policies and the need to build capacity of healthcare professionals. Next is that when we talk about capacity, there should be actual training conducted among hospital staff on disaster preparedness, on health emergency, and the persistent greening of healthcare as a way of building up resilience. As well, deliberate, annualized planning in facility level, covering not only healthcare services and taking care of patients, but covering as well resilience in our hospital plan is vital in preparing health facilities to meet emergency public health crises and disaster situation brought about by climate. And last but not the least of the points during day 3, there is the necessity of engagement with communities. As healthcare workers, as healthcare professionals and leaders, we need to simply work with the most vulnerable of communities, the women, the young people, the elderly, and have a better understanding of why resilience should also emanate from them, not only from the infrastructure that we built in our hospital. Finally, day 4 is today. We talk about the future with sustainable procurement, and the two presenters are great. And Susan took up many of all the questions during the open forum. Key points here is that if we talk about sustainable procurement, therefore we are addressing the largest source of greenhouse gas emission in hospitals. And this is found in scope 3 that include the supply chain in any hospital that we talk about. Thus, sustainable procurement, therefore, is a way to greatly reduce and effectively address climate change through decarbonization. And to broaden the supply chain component, as we introduced the tool in 2021 for healthcare facilities, which is the checkup tool, and there are already components that are addressing scope 3, but we must broaden this tool to further encompass other supply chain components in 2022 and onward. And we offer this to you, the members of the GGHH, for you to utilize and take advantage of, and we grow the tool further. And the last panel, just recently, just a while ago, facilitated by a lady, is a discussion on the necessity of advocacy, communications, and networking among hospitals, healthcare facilities, healthcare leaders, and the healthcare professionals as effective ways of reaching out and strengthening the climate movement within the healthcare sector and the green movement within the healthcare sector. So that's about it. And just to show to you the last slide is how our colleague Aaron in our communication is able to summarize everything in the whole 4 days or 4 afternoons of sessions that we have. I do not know whether Jit can show that slide. It summarizes and link in a visual manner what we were able to accomplish across the 4 days up to this afternoon. And it is a tremendous sharing of knowledge, experiences, the wealth of insights and innovations that are being conducted right in Asia. At the same time, learning from other regions. And as Susan said, they learned a lot as well from Southeast Asia and the Asian region in terms of certain actions on sustainability, greening, and resilience, promoting resilience in healthcare. And everything is summarized here in this visual presentation. And thank you to my colleagues and my staff, particularly Aaron, who was able to illustrate this all in one glance. So we do hope that this proves useful to you as I now turn this over to the closing remarks of the 4-day session, the pre-GHAC. Hopefully, we will see you all in India in the actual face-to-face meeting of the Green Hospital Asia event. Thank you so much.
Sermon,
Purnima?
I'd like you to, Sermon, this is Jit. If you can introduce first Dr. Lin for the members pledge. The GGHH
Shall I leave stage now,
pledge.
Jit, and give way to the closing remarks from Purnima?
Hello, can you hear me?
You do that. Thank you.
Can you hear me? Sorry, lady. Please proceed. There.
Before we move to the closing of this wonderful pre-GHAC conference, let us welcome the Vice Superintendent of Dalinchichi Hospital, Taiwan, to lead us with the GGHH Members Pledge. Ladies and gentlemen, Dr. Ming-Nan Lin.
Hello. Thanks for inviting me
Yes.
to talk on the pledge. The GGHH member pledge. I, Minnanin, represent Buddhist Darling Tzu Hospital, Taiwan, a member of the Global Green and Healthy Hospitals, recognized on our commitment in first, working towards the 10th GGHH sustainability goals. Second, sharing best practices and reporting progress in greening our operations. And third, advocating for both environmental and community health. In order to uphold and advance being green, healthy, climate smart, and resilient hospitals, health system or organization, we pledge to first, facilitate information exchange among members through the GGHH Connect Forum to increase collaborations and scale up sustainable actions. Second, use the GGHH resources such as guidance documents to educate our staff, patients, and the community on the solutions to sustainability and climate and health challenges. Third, utilize the climate impact checkup tools to measure our greenhouse gas emissions and develop mitigation plans. The fourth, take appropriate actions in reducing our climate footprint and preparing for climate impacts. And fifth, be a champion in advocating and campaigning for a low-carbon, non-toxic, and equitable health sector. Shown on this 7th day of December, year 2021. Thank you.
Dr. Lin, in lieu of the actual simultaneous pledging of members, may we ask our GGH members who are still here this afternoon to give us emojis, thumbs up emojis, to share with everyone that you also commit to the same pledge that Dr. Lin just read. Thank you so much, Dr. Lin, again, and thank you to our GGHH members who are here and have committed to the pledge. Thank you.
Thank you so much,
Thank
Dr.
you.
Lin. And now, as we near the end of this 4-day pre-conference and to officially close and give you a glimpse of the 6th GHAC happening in India next year, may I call on Dr. Purnima Prabhakaran, Deputy Director of the Center for Environmental Health. The stage is yours.
Thank you. Greetings to all the participants at this pre-GHAC 2021 from India. It's really a privilege and a pleasure for me to have the last word at the end of what has been, I think, a really, really fantastic conference with such a comprehensive program, deliberations with like-minded healthcare professionals. And I can't just, find the right words to record my appreciation to Sir Ramon Pascual and his team at the CIA office for having hosted this as a prelude to what's coming next year. And I just thought I'd take a few minutes to reflect on my own thoughts. Unfortunately, I wasn't able to attend the attend the program in its entirety. But I know from the program itself and from what I've heard from colleagues who attended that this has been really a very comprehensive discussion, engaging all the GGHH members in the region. So I was thinking about, drawing the parallel with the other pandemic that we are all still recovering from, and globally. And with that pandemic, the COVID-19 pandemic, we were really not prepared. It was something that just came on us, not just in one country or in one region, but on the entire globe. And we were not prepared. But we did our best to kind of respond to it and deal with that crisis. But the other crisis that we've all been talking about, and which is the basis of this whole conversation that we are all having here, the climate crisis, It's a crisis that is already here. It has been upon us for a while now. And it reminds me of, a statement made by my mentor and president of the Public Health Foundation of India, where I am associated, Professor Srinath Reddy, about 3 years ago at the Global Climate and Health Forum in San Francisco in California. He said, and I'll quote him, "Never before in human history have we been so forewarned of a doomed destiny. But never before in human history have we been so forearmed with the knowledge and tools to alter the course of that destiny." And these words ring so true for me, especially when I think about the work that we do with Healthcare Without Harm as partners and collaborators across the world. The work that we do has clearly shown us the way that we as the health sector can do to address the climate crisis. What is the role of the health sector in the climate change and the climate crisis? Why do we need to play a role? Right from the report in 2019, where Healthcare Without Harm talked about the contribution for the first time of the health sector to the global greenhouse gas emissions, about 5% of the global greenhouse gas emissions, to moving us forwards on actually a roadmap to addressing those emissions through the roadmap for decarbonization, which was also discussed at this conference, to actually giving us the tools to address that. I think when I think back to what Professor Reddy said, it's clear that we at the health sector are really empowered now in terms of how we need to play our role and play it correctly in addressing our contributions to the climate crisis. We have enough knowledge and enough tools now to act. And the time to act is now. Even if I was listening to the session earlier today by Susan Wilbur, the captain of the SHIPP project, as we call her, the whole conversation around the different scopes, the scope 1 and the scope 2 emissions, but the scope 3, the need to address our supply chain emissions as well. So that is a message which is telling us that we have a role to play as the health sector, but we also need to partner with other sectors because the big chunk of emissions comes from the supply chain. So what we need going forwards is, I think, partnerships for purpose. We need to commit for sure. And we did that very well in the COP. And I won't talk about the COP because it's been discussed a lot. I think there's a session later today which is going to unpack the health conversations around COP. Mon mentioned it earlier as well. But there was a lot of momentum created at COP a month ago to make health ministries around the world commit to decarbonization for the health sector. And I think that's a big win, but it's only a first step. We need to commit. Yes, we've done that in some ways, but we need to coordinate across sectors. We need to collaborate and we need to complete the task that we have all started. And I think we all have the power to do so. I think this collective momentum that is there in our region in Southeast Asia is really something that we all should be proud of. And I think we need to leverage the momentum and the power that we have here to make a difference to the world. And I think I'll take the cue from Lady. She said she's not Lady Gaga, but she has a versatility of her own. And the number of quotes that she said, I take the cue from there, and I will say as well that, alone we can do so little, but together we can do so much. And that's quoting Helen Keller, a figure that we all look up to. And really, I think it's also pertinent to bring forth another quote at this point. I am really feeling actually overwhelmed about the thought that, we are at the end of what is a prelude to something that is coming in the form of hopefully an in-person conference in India next year that we will be hosting, the GHAC 2022, which was supposed to be held last year, but thanks to the pandemic, we had to defer it not once, not twice, but then thankfully the CR office put together this virtual conference for all of you to just keep the conversation and the momentum going. So I'd like to quote Henry Ford, who all of us know as the person who was from the Ford companies and the Ford cars, the person who actually maybe for the first time brought together the concept of mass production. I think he said, coming together is a beginning. Staying together is progress. and working together is success. So I really want to say that, we all have a role to play. It may be a small role, but every drop in the ocean will make a difference. And I think we have made a start by coming together here and keeping the conversations and the momentum going with all of us in this platform. But we need to keep that conversation going forward as well, not least because we all have a commitment to our future generations. Again, the quote, I cannot articulate it correctly, but lady also mentioned that we borrow from the future generations. Our planet is borrowed from the future generations, and we have a commitment, if not for anything else, to leave a healthier planet behind for our children. So I want to close by thanking you all for joining this prelude to the in-person GHAC that I'm hoping we can host next year in India. I want to extend a warm welcome to all of you to make a sincere effort to travel to India next year. And we will be looking forward to host you all in a venue in southern India. And I'm going to turn it over with another note of appreciation to everyone who has been a part of this conference. And with a note of thank you to my colleague, Dr. Ishika Jaria, she's my project officer in the SHIPP project, for putting together this little video, which I am hoping will enthuse all of you to make that effort to travel to India next year to GHAC 22. So I'll hand over now to your secretariat and request you to please play that video for us. Thank you so much.
Thank you so much, Purnima, for the closing message and the very warm invitation addressed to everyone to be in India in 2022. I think everyone is excited to be able to travel again. And your video just made me crave for Indian food. So thank you so much, and I hope to see you all in person in the GHAC India event next year. I think this is the end of our 4-day conference, pre-conference for Green Hospitals Asia. confidence. So thank you so much to everyone, to those who have attended all 4 days, and to those who have stayed with us even beyond our scheduled time. So thank you very much, and I hope you have a safe and healthy and exciting and restful weekend, even though it's just Thursday. Thank you so much, and have a good night and good day, good evening to some of you. Bye-bye.